Hi, welcome to our channel of IGNOU audiobooks, Indira Gandhi National Open University, School of Vocational Education and Training, SOVET, Postgraduate Diploma in Pharmaceutical Sales Management, PGDPSM, MVE 002 Pharmacology and Toxicology. Unit-5 Drugs Acting on Blood. 5.1 Introduction. Blood is a fluid connective tissue that transports oxygen, nutrients and growth factors to individual cells of the body. The main components of blood are cell-like RBCs, WBCs, platelets, proteins, like coagulation factors, amino acids, growth factors, factors of the complement system, monosaccharide, ribose, glucose, minerals, Na+, K+, Cl, HCO3, and water. A lot of drugs can have an effect of one or more of these components and can bring about a change in the physiological homeostasis. In this unit we will be discussing those drugs that are useful in the treatment of disorders of the hemopoietic system. Objectives. After studying this unit, you should be able to discuss about anemia which occur due to decrease in number of red blood cells or hemoglobin content, anemias caused by blood loss, deficient erythropoiesis, excessive hemolysis, or combination of these changes. Enumerate the conditions where plasma substitutes expanders are used. About coagulants and anticoagulants. Enumerate their therapeutic uses, and discuss about the drugs used in the treatment of hyperlipidemia. 5.2 Hematinics and plasma expanders. 5th February 2001 Anemia. Anemia is the decrease in number of red blood cells or hemoglobin content caused by blood loss, deficient erythropoiesis, excessive hemolysis, or combination of these changes. Iron deficiency anemia is probably the most common nutritional deficiency in the world. It is estimated that at least 500 million people are affected. Iron deficiency anemia is much more common in developing countries, as people are consuming too little food or a limited variety of food. Infants and young children have higher iron requirement. For the first 6 months of life, these requirements are met by iron store in the infant's body, along with supplementation from breast or formula milk. Iron requirement increases during adolescence because of growth, muscle development and, for girls, at the start of menstruation. Adult women have higher iron requirement because of menstrual losses. During pregnancy it is not necessary to have extra iron in the diet because absorption increases and menstruation stops. The fetus is likely to get enough iron even if its mother has low stores, but mother becomes anemic. Anemia may be classified into different groups according to the pathophysiology. 1. Dietary deficiency anemia, which is due to deficient supply of various factors e.g. iron, folic acid, vitamin B12, vitamin C and pyridoxine which are essential for normal blood formation. 2. Anemia due to blood loss e.g. in severe gastric blood loss, ulcers, protozoal or worm infestation. 3. Anemia due to excessive destruction of blood e.g. sickle cell anemia and hemolytic anemia. 4. Anemia due bone marrow depression e.g. aplastic and hypoplastic anemia. 5th February 2002 Iron. The body iron is distributed mainly in 2 forms, one as heme in hemoglobin and cytochrome oxidase enzyme and other as iron bound to protein as storage compounds ferritin and hemosiderin, and as transport iron bound to transferrin. The total iron in human adult is approximately 3.5 g. After oral administration iron is absorbed in ferrous form. The conversion of ferric iron to ferrous iron is aided by hydrochloric acid. Only little amount of iron is lost by shading of intestinal mucosal cells and trace amount is excreted in urine, sweat and bile. After conformation of iron deficiency, iron therapy can be given by oral or parenteral route. Generally, oral iron therapy is given unless the patient is suffering from severe anemia, malabsorption syndrome, gastrectomy, or patient is showing adverse effects to oral iron therapy. It is used in the treatment of nutritional iron deficiency anemia, during pregnancy, lactation, to prevent iron deficiency in infants and children. In patients with malabsorption syndrome, patients who are taking non-steroidal anti-inflammatory drugs, NSAIDs, for long period, patients with chronic inflammatory disease, and in patients of gastrectomy. Preparations of iron alone or in combination with vitamin B12 folic acid are also available. Iron preparations also available in injection, parenteral, form as iron dextran and iron sorbitol citric acid complex. 5th February 2003. Erythropoietin. It is produced primarily by the kidneys. In anemia, renal secretion of erythropoietin increases rapidly manifold. Erythropoietin levels are always detectable in plasma. It stimulates proliferation, maturation and hemoglobin formation by committed erythroid progenitors. Recombinant human erythropoietin is available. It is given by parenteral route. 4 OSC. It is used in the treatment of anemia of chronic renal failure, in anemia of patients with AIDS who are being treated with zidovudine and anemia associated with cancer chemotherapy. 5th February 2004. Plasma expanders. Plasma substitutes expanders are high molecular weight substances, which, when infused intravenously into bloodstream, retain fluid in the vascular compartment and exert osmotic pressure. They are used in conditions where blood plasma has been lost, e.g. shock, burn cases, severe trauma and extensive tissue damage, as a temporary measure till the blood can be arranged. These do not have O2 carrying capacity. The clinically used plasma expanders are discussed here. Human albumin. It is obtained from heat-treated pooled human plasma. It draws and holds additional fluid from tissues. It can be used irrespective of patient's blood group. It does not interfere with coagulation and there is no risk of sensitization. Dextrans. It is the most commonly used plasma expander. It is polysaccharide isolated from beet sugar, which is formed by the action of leuconstake mesenterides. It is available in two forms depending upon the molecular weight. Dextran 70 mol, WT 70,000, and dextran 40 mol, WT 40,000. They are infused intravenously in the treatment of shock. Degraded gelatin polymer polygeline. It is a polypeptide similar to albumin. It does not interfere with blood grouping and cross-matching. It is a plasma substitute which corrects circulatory insufficiency due to plasma blood volume deficiency. Hydroxyethyl starch. It is similar to glycogen. The starch molecule is substituted to a selected degree to achieve a distinct plasma retention and volume effect. It improves hemodynamics, macrocirculation, microcirculation, organ function, oxygen supply. Polyvinyl pyrrolidine, PVP. It is a synthetic, water-soluble polymer of molecular weight approximately 40,000. It interferes with blood grouping and cross-matching. It also binds certain drugs, i.e. insulin, penicillin, etc. Because of these drawbacks, it is less commonly used. Dextrose, 5% solution. 1. It is used in prevention of dehydration of all types, excessive tissue protein catabolism, depletion of liver glycogen, and as a vehicle for 4. Administration of numerous drugs. 2. When oral intake of food and water is limited, as in pre- and post-operative patients or in the patients with severe hepatic or cardiac or gut disease. 3. Correction of deficit of water, as in case of inadequate intake and excessive losses in urine and perspiration. 4. In the treatment of ketosis in starvation, diarrhea, vomiting or high fever. 5. In promotion of sodium excretion when there is excess sodium in the body, due to excessive use of electrolyte solutions. 6. To provide adequate calories to the body. Normal saline. It is indicated in 1. When alkalosis is present along with fluid loss. 2. In case of severe salt depletion when rapid electrolyte restoration is essential. 3. In the treatment of low salt syndrome which may occur in presence of heart failure, renal impairment, during surgery, etc. In these cases chloride loss frequently exceeds sodium loss. 4. In severe salt depletion resulting from excessive fluid loss due to sweating, vomiting, diarrhea, etc. Ringer lactate. Ringer lactate contain calcium chloride, potassium chloride, sodium chloride, and sodium lactate is indicated in 1. For replacing the deficit of extracellular fluid due to decreased water intake or increased secretion of water even in absence of marked acid-base disturbance. 2. In case of burns, infections, fractures, peritoneal irrigation etc., for the restoration of normal extracellular fluid balance during surgery. 3. In moderate metabolic acidosis which occurs in cases of mild renal insufficiency, infant diarrhea, diabetic ketosis etc. 4. During or after giving anesthesia, to correct metabolic acidosis which results from disturbed respiration. 5.3 Coagulants and anticoagulants. 5th March 2001 Introduction. Thromboenesis is an abnormal state of hemostasis leading to the formation of arterial and venous thrombus, also known as white and red thrombus, respectively. Hemostasis is the spontaneous arrest of bleeding from the damaged blood vessels. Coagulation of blood comprises the formation of fibrin. There are 13 factors that are synthesized in the liver, which are involved in the coagulation of blood. Review of clotting mechanism. Hemostasis. Hemostasis refers to the arrest of blood loss from a damaged blood vessel, i.e., stoppage of bleeding. The mechanism is essential to maintain life. In case of any damage to a blood vessel, the hemostatic response must be times quick, times controlled and localized to region of damage. 3 basic measures taken by the body to reduce and stop blood loss are I. Vascular spasm. 2. Platelet plugs formation. 3. Clotting or coagulation. Clotting. Normally, blood remains liquid as long as it is flowing within intact, smooth blood vessels. But on damage to the blood vessel and or if blood is extracted from the blood vessel, there is conversion of liquid to gel state. This gel, on solidification, gives a clot. The process of conversion of liquid to gel is termed as coagulation. Clotting involves several factors called clotting factors. These include calcium, several inactive enzymes synthesized by hepatocytes and various molecules associated with platelets and or released by the damaged tissue. The clotting factors are denoted by Roman numeral, denoting the order of their discovery. Table 5.1. Table 5.1, Clotting factors. I. Fibrinogen. 2. Prothrombin. 3. Thromboplastin. 4. Calcium. V. Proaccelerin. 6. Accelerin. 7. Serum prothrombin conversion accelerator. 8. Antihemophilic factor. 9. Plasma thromboplastin component. X. Stewart-Prower factor. 11. Plasma thromboplastin antecedent. 12. Hagemann factor. 13. Fibrin stabilizing factor. Stages of clotting. Formation of prothrombinous. It can be formed by extrinsic pathway and intrinsic pathway. Extrinsic pathway. This pathway has fewer steps than the intrinsic pathway and occurs rapidly, within a matter of seconds if the trauma is severe. It is called the extrinsic pathway because a protein tissue factor, also called thromboplastin or coagulation factor 3, enters into the bloodstream from outside and initiates the formation of prothrombinous tissue factor is released from the surface of the damaged cells. It activates factor 7. Factor 7 combines with factor X, activating it. Factor X in the presence of Ca2+ combines with factor V to give active enzyme prothrombinase. Intrinsic pathway. This pathway is more complex and is much slower. It is so named as the activators are in direct contact with the blood in the intact blood vessels. No outside tissue damage is required. A rough vessel with exposed collagen is sufficient. Contact with collagen activates factor 12. This in turn activates factor 9. Factor 9 joins factor 8 and this gives active factor X. Factor X joins with calcium to bring about the formation of prothrombinase. Once prothrombinase has been formed, the common pathway is followed. In stage 2, prothrombinase and calcium catalyze the conversion of prothrombin to thrombin. In stage 3, thrombin, in the presence of calcium converts soluble fibrinogen to insoluble fibrin threads. 5th March 2002 Coagulants. These are the agents that promote coagulation and are mainly used in any hemorrhagic condition. They are classified as in Table 5.4. Vitamin K. Vitamin K is a fat-soluble vitamin found primarily in leafy green vegetables. Most of the vitamin K is synthesized by intestinal microorganisms. And there is a risk of vitamin K deficiency in newborn infants. Vitamin K is necessary for final stage of synthesis of coagulation factors, mainly factor 2, 7, 9 and X, in liver. The deficiency of vitamin K occurs due to liver disease, jaundice, malabsorption syndromes and chronic use of antimicrobial agents. Therapeutically, vitamin K is used in prophylaxis and treatment of deficiency of clotting factor due to dietary deficiency of vitamin K, chronic antimicrobial therapy, malabsorption syndrome, obstructive jaundice, liver diseases such as cirrhosis and hepatitis, in neonates to prevent or treat hemorrhagic disease of newborn, to counteract the overdosing of oral anticoagulants. The vitamin K analogues used clinically are menapthone, menadione, phytomenadione. Other drugs used as coagulants are tranexamic acid and polidocanol. 5th March 2003 Anticoagulants. These are the drugs used to reduce the coagulability of blood. The most important anticoagulants is heparin. The detailed pharmacology is discussed here. Heparin. Heparin is a heterogeneous mixture of sulfated mucopolysaccharides and quick-acting anticoagulant which shows efficacy both in vitro and in vivo and having a molecular weight from 4,000 to 40,000 depending upon the type of preparations. Its biological activity is dependent upon the plasma protease inhibitor antithrombin 3, which inhibits clotting factor proteases by forming equimolar stable complexes with them. It acts by activating plasma antithrombin 3 which rapidly inhibits activated coagulation factors IGNOU, XA, XIA and XIAIA, plasmin, kallikrein and thrombin, thus inhibiting conversion of fibrinogen to fibrin. It is indicated in the prophylaxis and treatment of deep vein thrombosis in major surgery and pulmonary embolism, treatment of atrial fibrillation with embolization, prophylaxis and treatment of peripheral arterial embolism. Low molecular weight heparins, LMWH. These are prepared by enzymatic or chemical hydrolysis of conventional heparin. Their molecular weight varies from 3,000 to 7,000. It is indicated in prevention and treatment of deep vein thrombosis and pulmonary embolism in surgical patients, prevention of extracorporeal thrombosis during hemodialysis. The clinically used low molecular weight heparins are enoxaparin, rivaparin, dalteparin, nadroparin, ardaparin and tinzaparin etc. Heparinoids. Uncrod is an enzyme obtained from Malayan pit viper venom. It produces heparin-like effect by degrading fibrinogen into an unstable form of fibrin. The unparoid is isolated from porcine intestinal mucosa and is used in deep venous thrombosis. Lepirudin is a recombinant derivative of hirudin, secreted by salivary glands of leech. It inhibits thrombin directly. Oral anticoagulants. They act by interfering with synthesis of vitamin K-dependent clotting factors in liver. They act as competitive antagonists of vitamin K and reduce plasma levels of clotting factors in a dose-dependent manner. They act by interfering with regeneration of active form of vitamin K. Factor 7 levels are reduced, first followed by factor 9, X and 2. Warfarin is the most commonly used oral anticoagulants employed for long-term anticoagulant therapy. 5th March 2004 Thrombolytics. These are agents used to lyse clot and recanalize occlude blood vessels. The most important indications are coronary artery occlusion, deep vein thrombosis, etc. The agents most commonly used are streptokinase, urokinase, and alteplase. 5th March 2005 Platelet-inhibiting drugs. These drugs interfere with platelet function and may be useful in prophylaxis of thromboembolic disorders. Abciximab is indicated for platelet aggregation inhibition as adjunct to percutaneous transluminal coronary angioplasty or atherectomy, PTCA. Aspirin in small doses inactivates irreversibly platelet enzyme cyclooxygenase, hence thromboxane A2 is not synthesized. It is indicated in prophylaxis in cases of increased risk of blood clotting, myocardial infarction, coronary bypass and unstable angina. 5.4 Antihyperlipidemic agents. These are the drugs used for treatment of hyperlipidemia. They lower the levels of lipoproteins and lipids in blood. The plasma lipids are present in lipoproteins. After combining with apoproteins, they are high-density lipoproteins, HDL. Low-density lipoproteins, LDL, very low-density lipoproteins, VLDL, and intermediate density lipoproteins, IDL. Atherosclerosis is main cause of cardiovascular deaths. It is characterized by a localized plaque in the intima composed of cholesterol esters, deposition of fibrous proteins and calcification. These plaques may narrow the arterial lumen and can cause distal ischemia. The coronary and cerebral circulation are main sites of atherosclerosis. Raised levels of VLDL, LDL and IDL are atherogenic, while HDL is protective because it facilitates removal of cholesterol from tissues. The important drugs used in the treatment of hyperlipidemia are discussed below. 5th April 2001 HMG-CoA reductase inhibitors. These agents are also known as statins. HMG-CoA inhibitors block the synthesis of cholesterol in liver by competitively inhibiting HMG-CoA reductase activity. This enzyme catalyzes the conversion of HMG-CoA to mevalonate in liver, which is an important early and rate-limiting step in the cholesterol synthesis. As a result, the cholesterol synthesis is decreased. 5th April 2002 Fibric acid derivatives. These agents activate the enzyme lipoprotein lipase, which is a key enzyme in degradation of VLDL, resulting in lower circulating triglycerides. These drugs lower triglyceride levels, decrease LDL cholesterol and increase in HDL cholesterol. 5th April 2003 Nicotinic acid. Nicotinic acid reduces production of VLDL by liver, thus its degradation. Products IDL and LDL are subsequently reduced. It inhibits lipolysis in adipose tissue and increases activity of lipoprotein lipase. It has no effect on cholesterol and bile acid metabolism. 5th April 2004 Resins, cholestyramine and colestipol. They are useful only in hyperlipoproteinemias involving elevated levels of LDL. They are basic ion exchange resins. 5th April 2005 Miscellaneous drugs. Probucol. It is cholesterol-lowering agent with antioxidant property. It reduces the serum cholesterol levels without reduction in serum triglycerides level and also reduces the HDL levels. It has no effect on VLDL and triglyceride levels. Guggulipide is an indigenous drug obtained from gum guggul used for treatment of hyperlipidemia, hypercholesterolemia and hypertriglyceridemia. SUC4. HMG-CoA reductase inhibitors block the conversion of to B inhibit the enterohepatic circulation of bile acids and increases their excretion in feces. C is a cholesterol lowering agent with antioxidant property. 5.5 Summary. Times anemia is the decrease in number of red blood cells or hemoglobin content caused by blood loss, deficient erythropoiesis, excessive hemolysis, or combination of these changes. Iron deficiency anemia is probably the most common. Times plasma substitutes expanders are high molecular weight substances when infused intravenously into bloodstream retain fluid in the vascular compartment and exert osmotic pressure. They are used in conditions where blood plasma has been lost, e.g. shock, burn cases, severe trauma and extensive tissue damage as a temporary measure till the blood can be arranged. These do not have O2 carrying capacity. Dextrans are most commonly used plasma expanders. Coagulants are the agents that promote coagulation and are mainly used in any hemorrhagic condition. Times anticoagulants are the drugs used to reduce the coagulability of blood. Times heparin acts by activating plasma antithrombin 3 which rapidly inhibits activated coagulation factors XA, XA, XIA and XIAIA, plasmin, kallikrein and thrombin, thus inhibiting conversion of fibrinogen to fibrin. Times statins block the synthesis of cholesterol in liver by competitively inhibiting HMG-CoA reductase activity. Times fibric acid derivatives activate lipoprotein lipase which is a key enzyme in degradation of VLDL resulting in lower circulating triglycerides. Thank you for watching. We will see you in the next video with the next chapter.